Hi, how are you?
I'm good. How are you?
I'm alright. My name's Casey. I'll be doing your HMP today. What's your name?
Melissa Robertson,
Alright, Melissa, what's your date of birth?
11/14/1967.
And you can tell me what year it is.
It's 2019.
And where are we?
Cleveland County.
Tell me what brings you in.
Just had a persistent runny nose for over a week.
Over a week. So it started a week ago. Is it worse now, would you say, than it was when it began? Or
Just hasn't gotten better.
And is it the drainage? Is it a clear drainage or color? Does it have?
Clear and thin and persistent.
Is there anything that you notice makes it better? Or is there anything that you have noticed that makes it worse? Are you around anything that makes the runny nose worse?
Not necessarily.
Not necessarily. Have you ever had a runny nose like this before?
No.
No. Okay. When was your last menstrual cycle?
3 years ago.
3 years ago. So, was that due to a surgical intervention or?
Yeah, hysterectomy.
Okay. All right. Are you allergic to anything?
Sulfa.
Sulfa drugs. Any environmental allergens that you know of?
No, just sulfa. I get a rash.
Okay. And you experienced that with antibiotics, I'm assuming. That's how you found out you had the sulfa allergy.
Mm-hmm.
No foodborne or nothing that you eat that makes you react?
Just the sulfa.
Okay. Tell me about your past medical history.
Let's see. I'm on no routine meds.
You don't take anything? Nothing. No herbs, no supplements?
Tylenol's my.
What do you use Tylenol for?
If I had a headache or a ache. Let's see. History, I do not have diabetes, hypertension, anything. No chronic illnesses.
Okay.
I had surgical history.
Okay, tell me about your surgical history.
I had a laparoscopic cholecystectomy due to a dyskinetic gallbladder, and that has been in the early 2000s.
Okay.
And then I had the robotic hysterectomy 3 years ago.
Okay.
I've had a reduction of a dislocated elbow under anesthesia. And then just vaginal deliveries of 3 children and 1 miscarriage.
Okay. So you said that you've got the 1 elbow reduction, no other ortho history?
No, I have a significant ortho history. Let's see. Dislocated right ankle. Hyperextension and ACL tear of my right knee. Separated left shoulder and separated right shoulder. Dislocated left elbow. Brain stick fracture of my right arm.
Did you play rugby or?
Gymnast.
You were a gymnast. Okay. Let's go back to your histo. Did you have first of all, do you have an OBGYN that you see regularly?
I do.
You've had a recent pap smear?
Yeah. I'm due for a mammogram and a pap smear.
And beyond your OBGYN, when was the last time you saw a regular doc?
Just OBGYN.
Just OBGYN. Any childhood illnesses or hospitalizations I need to know about?
Had pneumonia at the age of 1. And was hospitalized for the reduction of the left elbow.
That was when you were a kid?
But other than that, that's it.
Okay. What about vaccinations? You pretty up to date? Had your flu?
I just had my flu today.
You had your flu today? Pneumonia vaccination? You're not at the age where it's necessary for you. You don't have any history of asthma or reactive airway disease, correct? Okay. Any past medical history, family history that I need to know about?
Let's see. On the maternal side, there is a history of hypertension.
Okay.
high cholesterol.
Uh-huh.
Coronary artery disease in my maternal grandfather.
Okay.
Lung cancer in my maternal grandmother.
Okay.
And my uncle on the maternal side also had lung cancer.
Mm-hmm.
My mother had breast cancer.
How old was she when she had breast
She
cancer?
was 74.
So she was after menopause.
And it was non-estrogen.
Okay. Age.
And then on the paternal side, there's type 2 diabetes, hypertension, coronary artery disease, and chronic kidney disease.
Okay.
And that's it.
Any history of depression, psychosis, bipolar disorders?
My mother had diagnosis, they thought of major depression, but it turned out to be focal seizures, but she is treated for depression.
Okay. And on your dad's side?
None that I'm aware of.
Any familial history of suicide?
There was on my paternal grandfather's side, his brother had a history of depression, alcoholism, and 2 suicide attempts.
Okay. Any alcoholism on your maternal side?
I think remote on my maternal side, but paternally my father was an alcoholic, but he's abstinent now.
Excuse me. What about you? You've got some significant family history of high cholesterol and coronary stuff. Just, from your...
Last cholesterol was like 119, 120.
Do you smoke or drink?
No tobacco products, and I might rarely have a glass of wine.
Okay. No illegal drugs?
Nope.
You don't rave or party on the weekends?
No, too busy.
Okay, I understand. That being said, ever have any difficulty with dizziness or syncope?
That's remote as a adolescent.
Okay, you had some dizziness?
I did. But attributed it to just being very lean and
okay.
Workouts and not eating adequately.
Any history of migraines or headaches? Or...
I did have migraines as a teenager.
Okay.
But not currently.
Any change in your vision? Or do you wear glasses?
I wear reading glasses since about 42, 45.
Making sure that just wasn't a fashion statement.
It is a fashion statement.
It is. But it has dual meaning. What about any difficulty with your hearing?
Not that I'm aware of.
No changes of the recent. Any difficulty with or changes in your ability to smell or taste?
No.
Okay. Do you see a dentist?
No, I do.
Okay. No history of like dental abscesses or?
Nope.
Okay. What about your gastric history? Like, do you have? You said you talked about the gallbladder and the hypokinetic. That you had that removed.
I have a gastritis and a tolerance to fat,
which would be explained by not having a gallbladder. Any history or difficulty with nausea, vomiting certain foods that
just fatty foods generally make me. I don't have indigestion; they just make me a little nauseous.
Okay. And do you have regular bowel movements?
Probably once or twice a week.
Okay. Not painful bowel movements, no cramping or
no
diarrhea?
Not typically. Diarrhea with fat.
With fats. That makes sense. Okay. Any history of urinary tract infections or kidney stones or painful urination?
Not in a long time. I only had urgency before I had my hysterectomy. My uterus was apparently large, and that was made for your urgency, but I don't typically.
No incontinence with that.
Not since my hysterectomy.
Since I got better with you, so. All right. We talked about your ortho history. It's quite significant. You would say that you're pretty coordinated, though? No difficulty with motor
Generally,
skills?
I'm just super
graceful.
loose.
Mm.
I'm very flexible, overly flexible.
Okay.
So most of my dislocations came from hyper-reflexibility.
Okay. Skin-wise, though, any history of rash that won't go away, bumps, scrapes, bruises, or wounds that don't heal? Nothing? Nothing you've ever had to go see a wound clinic for?
I have had a significant burn. I had a third-degree burn a year ago.
Okay.
On my right leg.
And you went and you had to go to the wound clinic for that?
Yeah. I was under care of the wound clinic for about 3 months.
Wow. But no skin cancers, melanomas that you've had to have removed?
No, there's skin cancer on my mother had a basal cell, and my grandmother had a basal and squamous cell mix. So on the maternal side, yes, but nothing.
And nothing on your person?
I do see a dermatologist every year.
Okay. Good deal. And obviously, I mean, I can't fault you for being a little bit accident prone. I am myself, but any arthritis or painful joints or difficulty with range of motion that you could, articulate currently?
I would say that not really. I do have some achiness in the joints that I've injured in the past, more so since I had a hysterectomy. Mm-hmm. I didn't choose to use any replacement therapy.
Okay, so you're not
hormone replacement. But Tylenol usually takes care of it, and it's typically either with strenuous activity or
so not the weather. That you're not having to take Tylenol on a weekly or a regular basis. Okay. So now I'm going to do just a quick cognitive mental health exam. I'm going to start with asking you to remember 3 objects from around the room.
Okay.
We're going to start with a teapot, a plate, and a purse. A teapot, a plate, and a purse. Okay? Can you recite that back to me?
Teapot, plate, purse.
Okay. Now, I'm going to name a couple of things. I want you to tell me how they're similar, okay? You ready?
Okay.
A peach and a watermelon.
Fruit.
Okay. A lake and a creek.
Bodies of water.
Okay. A bicycle and a bus.
Vehicles of some sort. Transportation.
Good deal. Now, tell me, if I said an engine is to a plane as an oar is to a boat. Good deal. Tell me what these phrases mean to you. If I say, killed 2 birds with 1 stone.
That means 1 action accomplished 2 tasks.
Okay. Another that we say a lot around here is a stitch in time saves 9.
Doing something on time is more efficient, saves you working on.
Okay. I'm going to ask you a couple math problems.
Okay.
The first one, well, we'll just do one. Starting with 50 and subtracting 7, can you get to?
50 minus 7 would be 43.
Right.
43 minus 7 would be 60. 43 minus 7 would be 34.
Mm-hmm.
34 minus 7 would be 24. 24 minus 7 would be, let's see, 7. 17.
There you go.
And then minus 7 again would be 10. And 3.
Good deal. Can you repeat back those 3 objects we were?
Yeah. Teapot, plate, purse.
Can you do that backwards?
Purse, plate, teapot.
There you go. Can you tell me the days of the week?
Sunday, Monday, Tuesday, Wednesday, Thursday, Friday, Saturday.
Alright, can you spell the word, excuse me, it's tongue-tied, I got tongue-tied. Can you spell the word world?
W-O-R-L-D.
Can you now spell it backwards?
DLROW.
Tricky, isn't it?
Mm.
Catchy. Now, have you ever had any difficulty or history where you felt sad or hopeless for a long period of time, or over the course of the last 2 weeks? How often have you had moments where you were sad or hopeless or felt distressed?
Well, I think we've gone through a lot of family stress, so there have been times in the last 6 months to a year where it's been difficult. My mother's gone through a significant period of illness. But I don't think that I have felt sad that I couldn't get past or cope with. I tend to do art or read or do things to balance, because my work is stressful as well as dealing with family.
You ever had any difficulty with hallucinations or delusions?
I don't think so.
Any difficulty with your ability to focus?
At times if I get overstressed.
Okay.
But usually a list and a moment away from whatever I'm doing sort of
helps you to
refocus. I can reset.
You said you had a lot of family stress. Let's go back to your social history for just a second. Are you were working currently? You said your work is quite stressful.
Yeah.
And what's your marital status?
Married.
You are married. And have you been out of the country in the last 3 months? No. Okay.
We have traveled locally, but not in the country.
So getting back to your runny nose, and no, you said no fever with that, correct? Mm-hmm. Sounds like if you don't have a history of a lot of seasonal allergies, it is that time of year where people are having some more viral illnesses. Provided that it's not getting any worse and you can't pinpoint anything that makes it worse or better, you likely have a cold, and we should probably just treat it symptomatically and say rest and drink lots of water. Take Tylenol as needed for aches and pains if it does get worse. If the drainage changes and becomes thick or colored, or you get a productive cough, the temp gets up and above low grade, come on back and we'll probably start you on an antibiotic. I hate to start you on an antibiotic if it's just something viral that's not going to knock you down.
Sounds good.
All right.
Thank you very much.